Hello, Fairfax County Public Schools. This is Dr. Brabrand. Welcome to a new school year and our annual Return to School Town Hall. It's so great to see all of you this evening. We're glad you're here. And by the way, we know that many of you are experiencing downpours outside. Please be safe and make sure that you're safe as you're watching our program this evening. We're super excited to have you, though, this evening as we're returning 99.5% of our kids to 5 days of in-person instruction. We're truly excited about bringing everybody back this school year to reconnect in person and rediscover the joy of learning and reconnecting with peers and staff members and all of Fairfax County Public Schools family members. We also know, though, that with recent news about the Delta variant, there are many families with questions and concerns, really, about returning to school in person. And we're here this evening to help you answer some of the key questions you've asked us and also hear some more information about COVID transmission in our area here in Fairfax County. We have been doing so much work around vaccinations for our community, and particularly our staff and our young people who are now eligible at the age of 12 and up. And we're continuing to have aggressive strategies to be prepared as the vaccination rate is lowered from 12 so that we can get all of our students fully vaccinated as soon as possible this school year. I am joined this evening by Dr. Benjamin Schwartz, our director in Fairfax County's Health Department. And we're glad to have Dr. Schwartz with us again. He'll be sharing some slides, as I said to you, around the latest data and information that we have for COVID-19. And I am joined with Dr. Michelle Boyd, who is our Assistant Superintendent for Special Services and Health Services. And a little bit later this evening, you'll be hearing from our Assistant Superintendent, Mr. Jeff Plattenberg, who has responsibility for our transportation and facilities. So we really are looking forward to a very informative town hall this evening to share and answer your top questions and to take additional questions from the audience after hearing a brief presentation from Dr. Schwartz with the latest data around COVID-19 and our Fairfax County community. First of all, I want to go to some top questions that we have received in anticipation of this town hall. The first question is around, why can't my child go virtual? First of all, I want you to know that Fairfax County Public Schools remains committed to a safe and secure environment for all of our students and staff. We have been following from the beginning national, state, and local health guidance around return to school. At the national, state, and local level, all of the key health officials have said that we can and should return students to 5 days of in-person instruction. In fact, the General Assembly actually passed a law during the General Assembly session this year requiring all school districts to offer 5 days of in-person instruction this year. We have learned a lot about the safety mitigation strategies that need to be in place from our last school year, and we have those in place this school year as we return to school. We know a lot more about the COVID-19 virus, for example, knowing that the issue around surfaces or transmission by touch is much, much rarer in COVID transmission cases, for example. And we've made adjustments based on some of those realities. One of the big things that we didn't know last year that we do know now is around looking at COVID transmission within schools. We had amazing data that had, even when we had high cases of COVID transmission in our community, as we do now with the Delta variant, that we had very, very low transmission within our schools of COVID-19 throughout the last academic year. And we are prepared with multiple layered mitigation strategies this school year to make sure that we have great results again as we return all of our kids to school. We also know, as we talk about returning to school, that we have students that have academic and social emotional needs that must be met with in-person instruction. And we are prepared and ready to bring back all of our students and to begin to assess them, affirm them, and really advance their learning after what would now be 18 months of the pandemic impacting their schooling. So we'll continue to work very hard for in-person instruction and will be prepared for virtual instruction if directed by national and state health authorities to go to virtual. I want to go to another quick question is, why do students and staff have to wear a mask? Well, one, this has been recommended guidance from the CDC for some time. The American Academy of Pediatrics also recommended over the summer that everyone provide universal masking as we start school. But most importantly, last week on Thursday, August 12th, Governor Northam authorized mask wearing in all Virginia schools at every level, elementary, middle, and high. We know that masks are one of the essential mitigation strategies to lower transmission of COVID. And one of the things the Delta variant is doing, while it is not having more virulence, it is more transmissible. So everything we can do to limit transmission of COVID-19 in our schools, like mask wearing, we are doing to start the year. We actually, in Fairfax County Public Schools, announced the mask wearing requirement even before the governor did, and we're going to continue to have that as a tool unless directed otherwise by health authorities this year. I know another question we had that was popular that folks wanted to know, what's the threshold for closing schools this year? Well, first of all, we know a whole lot more about this issue of opening and closing schools. As I said, national, state, and local health authorities all support returning our kids to in-person instruction this year. We will continue, as we did last year, to look at our data. And our data will inform, in collaboration with local, state, and national authorities, will inform any decisions around closing a class, a school, or a school district. We believe very strongly with the mitigation strategies we have had in place and will have in place this year that we will not have to be in a position where we close schools. And Michelle, let's talk just a little bit about that threshold for closing schools. What more information would you like to share with our Fairfax County Public Schools community around that as we start this coming school year?
Thanks, Dr. Brabrand. So as you shared, this year is very much different than last year. And so FCPS is making a commitment to have our schools open unless a health issue indicates that we need to close. We know that in-person instruction remains critically important, and so we have not implemented various numbers for community transmission and outbreaks as we did last year. Again, we've learned so much through this pandemic. We look heavily to our health partners to help us to inform our decisions based on their knowledge, but in FCPS, we are committing that we are open for 5 days of in-person instruction.
Thank you, Dr. Boyd. I really appreciate that. Let me take one or two more top questions, and then we'll hand it over to Dr. Schwartz. Let me see if there's any additional information. I think there was a question about what will happen if there's a quarantine or closure. If we were to receive that direction from the health department locally or statewide, we would make sure that, for example, if it was an individual student and we're directed, that student would be asked to quarantine, and we would provide asynchronous instruction for that student until that student is cleared to return to school. Similarly, if we had a group of a classroom, Michelle, what would we do if we had a classroom of kids that were directed and a teacher directed to quarantine?
Certainly. So if we have a class of students who are directed to quarantine or temporarily pause while our health department partners conduct contact tracing and contact investigation, the entire class that is paused along with that teacher would temporarily transition to virtual instruction. So again, we're hoping that that will be a rare case, but we understand that we have to work collaboratively with our health partners and that they have to have access to students and families as they conduct that contact tracing and contact investigation. So there may be times where an entire class would have to temporarily pause so that that is done. But again, we will ensure that there's a continuity of instruction during that class closure, and that whole class, as well as that teacher, would be learning and teaching virtually. Similarly, if we close a whole school, the entire school would be instructed virtually.
All right, now let's talk a little bit about Dr. Schwartz, vaccination. One of the questions we're getting is, will you be requiring staff to get vaccinated, will you tell me if my child's teacher is vaccinated? Can you talk a little bit about what our current vaccination status is in Fairfax County around our staff? And anything that you want to share about vaccination work that the health department has been doing to get our vaccination rates up in our community?
Vaccination is the most important intervention. It's really the way that we're going to come out of this pandemic, is by people being immune as a result of being vaccinated. In Fairfax County, over 77% of adults have received at least one dose of vaccine, and over 70% have received a full vaccination series. So we're really doing well.
Those are tremendous numbers. Over 70% are fully vaccinated in Fairfax County.
Yeah, really among the highest of any jurisdiction in Virginia. Now, it still means that there are many people left to be vaccinated, and we in the health department strongly believe that vaccination is an important strategy. So while mandatory vaccination is a policy decision and not a policy that the health department would be in charge of making, we do really support and urge everybody to get the information they need in order to make a positive decision to get vaccinated, which is really more important than ever with the Delta variant.
One of the things, Dr. Schwartz, if we can go to the slide that you just talked about with vaccination rates, not just a great number for all of our adults over 18, but even for our adolescents ages 12 and 17, through partnership with the health department, we've had several school vaccination clinics at the end of last school year, and also just last week. We're at over 77% of 12 to 17-year-olds with one dose, and over 65% of those young people that are fully vaccinated. That is tremendous work and effort on your health department's part to really get the vaccination message out and get so many of our community residents to come in, and particularly our young people.
It's really been a wonderful partnership between the health department and Fairfax County Public Schools. And vaccination of adolescents, and particularly the 12 to 15-year-olds, is a much more recent recommendation, yet we've been able to vaccinate such a high proportion. Even more adolescents than young adults, for example, in Fairfax County are now vaccinated. So it really is a great success, and one that we need to continue to push for more vaccination.
And I know you shared the vaccination mandate really is a policy decision, and the Board of Supervisors did ask the county executive to explore a vaccination requirement for Fairfax County staff. That's certainly something I know Fairfax County Schools will be collaborating with the county executive as he does that exploration, and we'll have more information to share when the county executive has an update around that very important issue. So thank you. Dr. Schwartz, we'd like to have you take a few minutes just to take us through the state of COVID-19 as it relates to Fairfax County Public Schools, and maybe a little bit of information about the Delta variant, which is dominating the news and is part of what is some of the anxiety that some of our families feel as we are returning to school, all of our students in person.
Yeah, no, thanks so much, and thank you for the partnership that FCPS and the health department have had over the entire duration of the pandemic. And so what's shown on the slide, I hope everyone can see it on their screen, is the last 6 months of the pandemic. And 6 months ago, we were still coming down off of the fall and winter peak, the very bad outbreak that we had in Fairfax County. And numbers declined, and actually, as we moved into the summer with people moving outside, with more people in our county being vaccinated, the numbers in Fairfax County declined to, in some cases, fewer than 10 cases per day. But unfortunately, with the beginning of July and with the spread of the Delta variant, now case numbers have gone up once again. Clearly, we are not in the position that is being seen in many of the southern states, in Florida, Louisiana, and elsewhere, where vaccination rates are lower, but cases have increased in Fairfax County. You can see on the figure the spread of the Delta variant, which is shown in the dark orange on the bars on this graph. And at the end of July, CDC estimates that nationwide over 90% of all infections were caused by the Delta variant. What many people have heard is that this variant is much more transmissible than previous COVID strains, which is true, but it is not as transmissible as chickenpox. And so the memo that came out of CDC that said as communicable as chickenpox, not true, but it is true that it is much more transmissible than previous viruses. Now, the good news is that the vaccine still works against the Delta variant, and I'm going to get to that in a couple minutes. But sticking with the community transmission, CDC has defined 4 levels of community transmission: low, moderate, substantial, and high. If we go to the next slide, you can see that Fairfax County at this time is in substantial transmission. And so this is how we are tracking where we are in the county in terms of the current rate of disease. Next slide. Here are some of the numbers that we were talking about, where over 77% of adults have received at least 1 dose, also over 77% of adolescents. And the number of adolescents who are fully vaccinated is a little bit lower. And the reason is that many adolescents have been vaccinated more recently and haven't yet had the opportunity to get the second dose because those 21 days have not passed from the time they received their first dose. Next. As I mentioned, the COVID vaccination has been very effective even against the Delta virus. And so there is particularly high effectiveness against serious disease, those diseases that may lead to hospitalization or death. And while no vaccine is perfect and breakthrough cases have occurred, even against COVID infection, the vaccine is a very good vaccine with high levels of protection. As has been said, this is largely a pandemic of the unvaccinated, with a large majority of cases occurring among unvaccinated people. Next. And so vaccination is widely available and it is free. The best way that we can protect our community and our students and keep schools operating with in-person education is for people who are eligible to get vaccinated. For those who are too young to get vaccinated, hopefully we'll be seeing the mRNA vaccines authorized for use in younger children sometime this fall. But until then, parents getting vaccinated, other family members who are eligible getting vaccinated, caregivers getting vaccinated, and people in the community generally getting vaccinated will protect the younger children who cannot currently receive vaccine. And there are over 200 sites around Fairfax County where vaccination currently is available. I'd also like to emphasize that vaccination is only one of several layered prevention strategies that Dr. Brabrand already has talked about. And the other strategies are shown here, and these should be familiar with all of you because they have been consistently implemented throughout the pandemic. So they include the consistent and correct use of masks as well as these other strategies. Let me go to the next slide and just talk a little bit about the evidence for masking. And CDC, in a recent report, highlights that compelling data now demonstrate that community mask wearing is an effective intervention to reduce the spread of infection as source control, in other words, preventing spread from infected persons, but also reducing wearers' exposure to infection. And this compelling data comes from multiple studies, from multiple countries using different methodologies, and all of it consistently shows that masks do afford a substantial degree of protection against the spread of coronavirus. So by using this strategy, layering in the other strategies which are being implemented through FCPS, we feel confident that the number of COVID cases and the risk of transmission in school settings can really be minimized.
Thank you, Dr. Schwartz. Why don't we go ahead and take a few calls. Callers, welcome to the Return to School Town Hall.
Hello.
Oh, welcome.
Hi. So I have a question in regards to lunchtime PE. And I'm just concerned about when the kids will be in the cafeteria eating lunch and taking their masks off. And then even just PE outside, I think sometimes they will be able to be in PE without a mask as well when they're doing certain activities. And I'm just concerned because the children that are not eligible to be vaccinated yet, I mean, they are going to be within distance of each other with no mask on. It just feels like there's a good chance that they could get something if there is COVID floating out there. And I just had a question in regard to, are there any options that we could have, like possibly having outdoor tents and maybe the children could eat outside, or maybe if a parent didn't feel comfortable having their child eat in the cafeteria, they could pick them up during lunchtime. Yeah, that's basically, I just feel like being able to take their masks off at certain times of day kind of defeats the purpose of them wearing the mask for the rest of the day.
Well, that's a great question, caller. Thank you for reaching out. I want to talk a little bit about how lunch will look in schools, Dr. Boyd. We've had a lot of questions about that, and we provided a lot of very detailed guidance to schools, both our middle and high schools, but also our elementary schools, where we're probably hearing more of our concerns. Dr. Boyd, can you kind of step through, and I think we have a slide that we can actually put up, to step through for our community, what will lunch look like in schools, and what have we been doing to get ready for kids to return, not just to the classroom, but to the cafeteria?
Thank you, and thank you, caller, for the question. Again, as Dr. Schwartz and Dr. Braybrand stated earlier, mask wearing is one of those key layered prevention strategies that we will be implementing at the universal level in schools. But to your point, caller, there are times during the day where our students will have to remove their mask, such as times when they're eating and drinking. And so one of the expectations, as we've implemented a number of things throughout our district, but one of the expectations is that students would only remove their masks during times when they are actively eating and drinking. And so the remainder time that they're in lunch in the cafeteria, if lunch is in the cafeteria, because we also know that we can access lunch outside in other spaces at many schools, and they've set up a number of options across the school division. But when students, if they're inside the building or inside the classroom or cafeteria eating, once they're done actively eating, we've asked them to put back on their face masks so that they can still interact with their friends, because we want them to have that social piece, because that's critical for the social emotional learning pieces that Dr. Braybrand talked about before. But we want to do that in a way that is safe. And so a number of strategies and resources are going to be implemented. We will be implementing physical distancing to the extent possible within existing resources. And so we do want to share that that might look a little bit different from building to building. And so our principals are going to talk inform all of our families, inform our students about what that will look like in their child's specific school. You've mentioned that some schools will access tents, so some schools may be having tents not only for cafeteria and for eating spaces, but they might also access those tents for instructional opportunities to create extra space for physical distancing. And so one of the biggest takeaways is that we'll continue to use frequent hand washing, hand sanitation, because that continues to be key as well. And we are limiting the time that our students would have those mask offs in the cafeteria. But they'll also have an opportunity to have those mask breaks when they're outside and playing. That's so key for some of our youngsters that have recess, and we know that that was a key piece that many of our families advocated before, and so they will have that opportunity to do so in a manner that's safe.
One of the things, caller, just to wrap up on lunch, not only are we going to do our best to give kids the space in the cafeteria, outside, in our outside classrooms, and we've ordered over 50 of those across our school system, but at elementary, we are having, as we start the year, assigned elementary school seating in the cafeteria. We're going to tell kids to mask up as they go through that lunch line, mask up while they're putting their lunch out, and only to remove the mask while eating or drinking. We'll be monitoring that, encouraging the kids the moment you finished eating, put the mask back on, continue to talk, engage with friends, reconnect, but really limit the amount of eating and drinking during the cafeteria time. And we're going to continue to look at our data to help us drive decision-making throughout the school year. We kept COVID transmission low in our classrooms and in our cafeterias last year, and we're committed to doing it this year as well. Let's take another phone call. Caller, welcome to Return to School Town Hall.
Good evening. Given that approximately 50% of FCPS students are not yet eligible to receive the vaccine, the increased transmissibility of Delta, and that physical distancing beyond 18 inches is not being guaranteed anywhere in FCPS, and the fact that COVID infections impact students with disabilities disproportionately compared to non-disabled peers, with an infection likely causing a student to be out of school for a longer amount of time. What is FCPS's plans for situations where a student, a teacher, and class would need to isolate or quarantine? What is the plan for the provision of special education services in those situations?
Sure. Thank you, caller, for that question. We know you have a concern, and many families do, about what would happen if we have a quarantine and kids or a class are directed. And Dr. Boyd, can you go over a little bit more? Again, we talked a little bit about the individual student as directed by the health department. The classroom is directed by the health department. What, again, exactly will take place if we move a class, for example, and the special ed kid? How will they receive special education services during the quarantine?
Sure, and so caller, thank you so much for that question. We talked about it a little bit earlier, but we'll go back and unpack it just a bit more so that to make sure that we fully answer your question. In cases where a full class is transitioned to virtual, or directed to temporarily pause and or quarantine or isolate, that entire class would receive instruction virtually. And so that would be provided to students that are general education students as well as students with disabilities. In cases where the entire school is closed as directed by the health department for a public health matter, again, that would be the time when the entire school, including both students with disabilities and those without disabilities, would be instructed virtually. I think your question might lean a little bit more towards individual cases where one particular student, Michelle Boyd, for example, is directed by the health department to quarantine and the rest of my class remains open. At this time, Michelle Boyd, for example, as the student would have access to work through asynchronous learning opportunities, whereby the materials and instructional resources will be provided by the teacher through Schoology or other classroom platform asynchronously, or there would be opportunities for the family to pick up those instructional materials at school if that was the preferred mechanism. We continue to partner with the Virginia Department of Education to ensure that we are meeting the standard for the provision of special education services, and we continue in that collaboration. Should something change, we'll be sure to communicate that information to all of our families, but also as we partner with a number of special education organizations to include ACSD and SEPTA as well, and to make sure that all of our families have that information. So we'll continue to partner with you to make sure that all families are informed as we navigate this dynamic pandemic.
Yeah, you know, Dr. Boyd, the bottom line is if a kid or a class needs to quarantine, we're going to transition to virtual instruction. Asynchronous assignments will be provided, and we'll continue to really do everything we can to return those kids back to class as safely and as quickly as possible per health department guidance. One of the things I just wanted to ask, and I know Mr. Plattenberg, you're here to join us. We were talking about the layered strategies of prevention. Dr. Boyd and Dr. Schwartz have talked a lot about masks. Can you talk a little bit about some of the safety stuff that we've been doing with ventilation, sanitation, and some of the work that we've done to create these outdoor spaces that callers have been asking about?
Yeah, thank you, Dr. Braybrand, because that's an excellent point. It's these layered or tiered effects that we put into place not only last year, but also from what we've learned, enhancing them along the way. So, for example, we have 27 million square feet of physical plant, and that's the equivalent of over 4 Pentagons. Over 220 facilities, of which, within all of that, we have approximately 35,000 mechanical pieces of equipment. And within that, we have 45,000 filters and 800 different sizes and shapes of those filters. So when you talk about, does that seem like a large amount? The answer is, it is. Fundamentally, functionally, it is. We've upgraded all the filtration system in accordance with the ASHRAE guidelines that were a supplement to the CDC information that basically recommended MERV 13, where we could fit them in. Where we couldn't fit them in, we've gone ahead and purchased air purifiers with HEPA filters to supplement our program. We have a robust mechanical filter replacement program that every 90 days we replace all of our filters throughout the system. That is a huge undertaking, but we have been progressively working within that. We've tested all of our facilities to make sure we have outdoor air coming in at the rates that are recommended. We have up from 6 to 10 exchanges per hour, meaning we have 100% fresh air, new air coming into those spaces per hour. So in addition to that,
We've done massive upgrades with our air quality.
we have, when you have such a large system, you've got many different layers. As I mentioned, the number of mechanical systems that we have and the various types, it's challenging to stay up with all of them when you talk about the age and condition. But yes, we have. But when you think about that, and you talk about the air exchange and the things that people have been concerned about, we have a robust, aggressive program. And we didn't just do it internally. We went ahead and got the Well Building Institute to come in as a third-party speculative group to come in and take a look and assess our operations. And every one of our facilities were verified and certified by the Well Building Institute for not only our maintenance and cleaning, sanitization efforts, our air and water quality, et cetera. So we've been aggressively moving forward.
I know we're also going to continue to provide additional sanitation measures, both in our classrooms and on our buses at the beginning of the day and the end of the day. Anything you want to share about
excellent
that?
point. I mean, when you take a look at the air, we've also got these mitigation measures, these teams that are coming in. But in addition to that, you mentioned transportation. Our buses are going to be sanitized in the morning after the first runs, and then at the end of the day, after the last runs. But I have to tell everybody, we, along nationally, are suffering from a severe bus driver shortage. I cannot stipulate that enough. You've heard of surrounding jurisdictions, the impacts that it's had, and we know we are having those impacts as well. When we take a look at that, what does that mean? What that means is longer bus rides. It means that we will have what's called double backs. A double back is basically when a bus picks up students in the community and brings them to school. They have to double back and go pick up additional students as well. We haven't had that on a regular basis, and we're looking at that this year. So if anybody out there wants to become a bus driver, come join the best bus drivers in the school system in the Commonwealth of Virginia. Become a Golden Angel, and we'd love to have you because we need it.
Well, thank you, Jeff. Thank you for all that your transportation and facilities team have done to keep schools safe. And we really appreciate and applaud all of our staff, and our bus drivers are a big part of the FCPS family. We've increased our bonus for hiring for bus drivers to $2,000. So yes, as Jeff said, I love the phrase Golden Angel. Come be a Golden Angel, transform the lives of kids and families so that we can get our kids safely to school and back back to home. Please, please go to our website, learn more about being an FCPS bus driver, and we'll continue to communicate directly through our schools to families about any transportation adjustments that may be needed. Let's take an email that we've gotten in. A question there is, what happens if I want my student to wear a mask at outdoor recess? Dr. Boyd, how about that one? We're not requiring masks outdoors, though we recommend it when there is substantial or high transmission, and that's what we're in right now. But what if I want my student to wear a mask during outdoor resource?
So Dr. Brabrand, you're correct. Masks are not required outdoors, so when kids are outside for recess or PE or other activities, they're not required to wear a mask, but we do recommend that in those crowded spaces or during activities where there's sustained close contact, we recommend that students wear face masks during those times. So we are really asking to partner with our families. If you want your child to wear their face mask, we ask that you first communicate that expectation to your child, sit your child down, have the discussion, and we can help you with the explanation as to why it's important when they're in crowded spaces or sustained contact, or if you just want your child to just generally wear their face mask at all times. Please communicate that first to your child. We found that the students last year have been very, very receptive to adult expectations, and we know that we have some pretty amazing students in FCPS and know that they'll continue to do that. Secondly, our staff are going to do their best job to reinforce your expectation. So if you share it with your teacher, your student's classroom teacher, that you want them to wear their face mask outside, we're happy to encourage that, but we ask that you first and foremost communicate that to them, because we have families that will have different expectations, And outside, it's a recommendation in those situations where it's crowded or close sustained contact, but not a requirement. And so again, we want to partner with you. Please share your expectations with your child, share them with your teacher so that we can work collaboratively to implement the face masking outside if that is your preference for your child.
Dr. Boyd, another question we've gotten about collaboration with the teacher. How does a parent know if someone in their child's class has tested positive for COVID-19? What are our protocols in place this year around that?
Absolutely. So if someone tests positive in your child's class or your child's school, families will be notified. We believe in open and transparent communication. We know that we still, as Dr. Schwartz has said and as Dr. Braybrown has shared, we are still in a pandemic. We've made progress. We have vaccinations. We have the implementation of layered prevention strategies. But we know that the pandemic is still alive and that the virus is moving. And so in a case where someone in your child's school or class, whether it be a student or an adult, you'll get a notification that there was a positive case in your class. And if your child is going to be temporarily paused for contact tracing and investigation, you will receive direct communication from your school. And if your child is identified as a close contact, you would have that conversation directly with persons from the health department that would give you guidance about next steps. And so again, in short, we are going to continue to collaborate with our families. We will continue to have the availability of our COVID dashboard because again, transparency is key so that you're aware of what's happening in your child's school and across our larger school division as we work together as a community.
Thank you, Dr. Boyd. Let's take some more phone calls. Welcome to Return to School Town Hall. Welcome, caller.
Hi, I'm calling to ask a question, I think mainly Dr. Schwartz, and my question is about test to stay instead of quarantine. This is happening in Massachusetts, and I think also happened in Utah last year, where students who are identified as close contacts, instead of having to go home and do asynchronous learning, would be allowed to take a rapid test at school. And as long as that test goes negative, they can stay at school. If the test goes positive, then they do obviously have to go home and quarantine. But as a parent of young kids, I'm really dreading the thought of my children being quarantined as contacts because they were playing with somebody at recess and they're not vaccinated. And the idea that there might be a safe and effective way to keep contacts in school without spreading COVID is really appealing. So I'm hoping that Fairfax County can consider that possibility.
We are not making that recommendation at this time. So Fairfax County is still doing the investigation, and for people who meet the definition of a close contact, quarantine is still being recommended. I am familiar with the reprint of a preprint of a medical study which looks at testing every single day as an alternative to quarantine. And we need to look into that further. The paper has not yet been peer-reviewed, and so it is something we're looking at. But again, right now, the safest approach is the approach that we're following where close contacts do get quarantined.
One of the things, thank you, Dr. Schwartz, for sharing that from the health department's perspective. One of the things I know we're doing, Dr. Boyd, is we're really thinking about the ramping up of vaccinations that we do expect to happen as that vaccination age drops from 12 down to 5, that we're going to have a huge surge in demand. And while we'll continue to partner with the health department, we may even need additional support to deal with that demand and this issue about testing. Can you talk a little bit about some partnership work that you were doing in the event that those issues around vaccination and potentially the testing of the preprint that Dr. Schwartz talked about, things that we're looking at right now?
Absolutely. So as Dr. Braybrown shared, we have had an amazing and phenomenal partnership with the health department, really in getting our staff vaccinated on last year when vaccinations first became available, and then providing some on-site vaccinations for our students once that became available. And so we are eager to continue that partnership as the vaccination availability is dropped down for some of our younger age students. In addition to that partnership, we're also in the process of partnering with the third-party provider to support our surveillance testing or screening testing for persons who are asymptomatic, so persons who by and large look and feel well, but to make sure that we're identifying COVID as soon as possible. So we're working to establish a third-party partnership, and we are very, very excited and hopeful that we'll be able to release details about that in the coming days, about that screening testing availability as an additional precaution, especially for our elementary school students and staff. We know that, again, with elementary students not being age eligible, we know that some of our families have concerns about persons being COVID positive in school and perhaps being asymptomatic. And so that's why that screening testing is going to be critically important.
Dr. Boyd, one of the things, you mentioned the screen testing, but also these mass vaccination clinics. We've done a lot with the county. We did some with Inova. When that age particularly drops, will we be doing clinics at our schools in Fairfax County to increase the vaccination rate, not just for our middle and high school kids, but for all these elementary kids? We know this year the vaccination is coming for our youngest learners. How will we be ready to provide and support vaccination efforts for them?
Absolutely. So we will be providing some targeted clinics on site for the younger students once those vaccines become available. And we're looking at establishing, again, to continue our partnership that we have with the health department and doing that, but also the third party for any gaps that we may have, any additional capacity. In addition to screening testing, this third party will be able to support us with COVID vaccinations, but also school entrance immunizations for our students who would have gaps with those school entrance requirements. And so we're really working to stand up through a number of partnerships, again, our longstanding partners with the health department and adding on this third-party provider to really provide some robust resources for our community to help make our community safer and stronger.
One of the things, Dr. Schwartz, I saw the American Academy of Pediatricians did write to the FDA just a week or two ago, urging the FDA to review as safely as possible, but as quickly as possible in a safe manner, the emergency authorization for those mRNA vaccines so that they can be lowered, at least the Pfizer, which is already down to 12, could be lowered to 5. So that we really can start the school year as soon as possible. Our state vaccination czar, Danny Avula, actually just shared a few days ago that he's hoping the word will come in September. Do you want to make news tonight and tell us anything about the ability for when you believe the vaccination age will be lowered by the FDA, or do we need to wait for the next town hall?
I wish I had some special insight into when the vaccination is going to be approved for 5 to 12-year-olds, and I have no other information to share other than that we too hope that it occurs as soon as possible.
Well, we're going to keep following that information, and we'll update you all not only here at the town hall, but on our FCPS website, www.fcps.edu. Let's take one more email, and then we'll see about some calls. Are you still providing internet access to students? And the answer is yes. If you're having internet access issues at home, please let your school know as soon as possible. We can provide students, eligible students, with a MiFi device. We don't want any kid not to have it. In fact, I want to make sure, as we talk about going back in person and some being concerned about virtual, I want all of you to know, if our health officials tell us that more concerning trends have arrived with COVID-19 and the Delta variant or any other variant, we are fully prepared with plans to transition a class, a school, or the school district virtually. In fact, by the first week of school, we plan distribution of a device to every single kid in every single school. We will be prepared. We are planning for and are prepared for things if they were to get worse, even as we hope for the best. And we remain hopeful, just like last year, even before having a vaccination, that our layered mitigation strategies done to fidelity in schools can really keep our COVID transmission in schools extremely low. And it was extremely low last year. We hope and hope very much that that will be the case this year. Let's take a phone call. Caller, welcome to the Return to School Town Hall.
Hi. So my question is that we have the infrastructure for online education that's been put in place from last year. why not use it for the kids that are under 12 and are not vaccinated, to help parents that are uncomfortable with sending their child into in-person schooling rather than having them look into homeschool?
Thank you, caller, for that question. I know that is a question some of our families are asking. And I'd say to you this as an educator and as a parent, that we have consulted local, state, and national health officials, and all of them have said that returning kids to in-person instruction 5 days a week is the doctor's recommendation this year, and we have followed it. In fact, the guidance has been only those kids with documented medical need should be assessing virtual education. We have done that for our 400 to 500 students who have provided that documented medical need. We believe all of our students need to be back for in-person instruction. We're prepared to go virtual if we need to. And what we want to do is help reassure you that we have the strategies in place to continue to have safe and strong in-person instruction in our schools this year. Let's take another call. Caller, welcome to Return to School Town Hall.
Hi, my name is Adnan. Thank you so much for this town hall. My concern is that I think we are implementing some decisions, and some of the plans were created before Delta really surged across the country, and because of its impact on children. And I have an elementary school kid who cannot be vaccinated. So, and the General Assembly made the decision back in February for all in class. And I'm wondering the doctors who had given the advice if they were giving the same advice now after the surge in Delta. So should we not delay return to school for elementary school children because of the Delta variant if we were making this decision now and not a few months earlier?
Thank you, caller, for that call. I have to tell you that I stay in regular touch with local, state, and national health officials. I stay in touch with our American Academy of Pediatricians, including our state president, who was at one of our prior town halls. And all of them continue to recommend and continue to emphasize that returning all of our kids to school for in-person instruction is the right prescription for this pandemic. We need to continue to recognize the power of having in-person instruction. Now, we know that if your child has significant medical issues, we do have a virtual option for that child, and we have information that is available about that on our website, and we encourage you to look at that. But we will continue to consult very carefully with our medical authorities around this very important issue. Dr. Schwartz, anything else that you would want to say to the parent around this topic?
Just to echo what you said, that the CDC, the American Academy of Pediatrics, our health department, all recognize the importance of in-person schooling. And while the Delta variant is more transmissible, we know how it's transmitted. We know the effectiveness of our layered strategies. Hopefully we'll have vaccination for younger kids coming soon. And with the strategies that we've all talked about today, the number of cases can be minimized even with this more transmissible variant.
Thank you, Dr. Schwartz. Let's take another call. Caller, welcome to Return to School Town Hall.
Hi, my name is Sierra. I was calling because I know you have touched on it already that we have the option to do virtual learning for our students. My daughter has cancer, and she's also she has asthma. I've reached out to over 15 different people, and I keep being told the deadline was May 29th, and no one's willing to help me. So what are you guys doing now? Because her doctor did recommend she can go to school, but now has changed that recommendation with the increase of COVID cases. So I'm wondering what we as parents can do. And then also I had a second question after that about the guidelines for wearing a mask outside, because they have changed today according to the CDC, where they are recommending them now in outdoor settings. So I just want to address that as well.
Well, let me do the first one. First of all, please, I'm sorry to hear about your child and the current diagnosis. Please contact your school principal, and we'll work on getting the appropriate remedy to your situation. I'm very sorry to hear about that with your child, but we'll work to get the right solution for you. Please contact your principal tomorrow and we'll follow up. As far as the second question, I have not heard information yet, not saying, we're on live TV and news does happen that there has been a change yet from the CDC around outdoor masks, but we'll certainly follow up and review that information. And if there's additional new information to share, as we always do, we'll provide updates to our FCPS community around this issue of masking outside. Thank you.
And Dr. Brabrand, if I might just add to, again, we are going to follow up directly with the parent who called, but for families who might also have a child who has a medical condition and perhaps an application had not been submitted prior to the deadline, please also know that we also have homebound as another option to support students who have medical needs whereby their physician indicate that they can't be in school. And so please, again, reach out to your school. Also feel free to reach out to the Department of Special Services so that we can provide you with resources about options based on discussing your child's individual circumstances. We are here to partner with you, and we know that each person's situation is a little bit different, and we want to make sure you get connected with the resources that are appropriate for your child and your particular situation.
Let's take another call. Caller, welcome to Return to School Town Hall.
Hello, Dr. Brabrand, and thank you so much for the town hall. My question is, which you may have already answered it, why are teachers not required to be vaccinated, especially in elementary schools?
Sure. Well, a couple of things that are going on with that. As I shared, about 2 weeks ago, the Fairfax County Board of Supervisors asked County Executive Brian Hill to explore the vaccination mandate for county workers. I have been in touch with the county executive. We are staying in touch as he explores this potential mandate for county employees, and we certainly would be giving it a thorough review ourselves, and I would be working with the school board based on whatever recommendation County Executive Hill has. We have cooperated very carefully with the county on a host of issues during this pandemic. This would certainly be one of the issues that we would. I also want to just share, it is interesting to note to our audience that two of the largest teacher unions in the country who have representatives here in Fairfax County Public Schools have both come out and said they are in favor of vaccination mandates for educational staff. So we will continue to keep you abreast of any vaccination mandate requirements. I do want to confirm we have checked out on the website that there is no CDC requirement at this time for outdoor masking. We did have a caller ask about it, but we've done our fact check and there is no current outdoor masking requirement per the CDC. There is not one. We will continue to follow CDC guidance or any updates to the guidance as we receive it. Masks currently in FCPS outside are recommended during high or substantial transmission. Let's go to one more email. Will there be additional cleaning this school year? Mr. Planenberg, thanks again for joining us. What are we doing around additional hygiene and cleaning? What did we do last year, and will there be additional things or new things that we're doing this year?
Yeah, that's an excellent question and one that comes up frequently. So I appreciate it. Yeah, we have our protocol for our custodians and our cleaning staff, our housekeepers, as we call them, to go ahead and do the high-touch areas, to continue doing that. We have found that that was pretty effective with all of the layers that you've heard about. In addition, we do have the mitigation teams that will be monitoring and ensuring that we have hand sanitizer, that the bathrooms have all of the supplies that they need to have on a recurring basis. And our program is one that we take very seriously. We have a reporting out elements to it. It is a contracted component that we do have, but it's an excellent question, and I'm glad we received that again this evening.
Thank you, Mr. Planberg. I want to see if there is any additional questions that we might have. Let's take, I'm seeing that we may have already gotten all of our questions in for tonight. So I want to just take a moment to thank all of you again for coming in. I'm committed to continuing to provide transparent communications, open communications, and to hear your feedback. There is more information on return to school at our website at www.fcps.edu. Dr. Schwartz, I want to thank you again for coming in, and to all of your colleagues in the health department. Throughout this 18 months of the pandemic, you and your colleagues have been such collaborative, warm partners with us. We know it's been a time of extremely high stress. And for you all in the health department, I know you've had the brunt of having to deal with what is anxiety in a time when people want certainty. And I just want to thank you for bringing the data, bringing the information, bringing the science, and knowing that we're going to continue to work with you and be guided by science as we make our key operational decisions for our kids. So thank you, Dr. Schwartz, for being here.
Thank you, and we certainly value the partnership as well.
Well, thank you, and thank you, Dr. Boyd. We're glad to have you back with us for all the work you've done with our special education students and health services. And Mr. Plattenberg, again, a wonderful job keeping our transportation going and keeping it safe and clean, as well as our facilities, and really giving us all the updates. We're really happy for everything you've done. We'll see you next week, the first day of school in Fairfax County Public Schools. Have a great evening, everyone, and see you soon. Bye-bye.